Hello, my name is Taylor Conti, and today I'll be talking about HIV and AIDS. As an introduction to HIV, HIV is known as a human immunodeficiency virus. This is a virus that attacks your body's immune system and makes it difficult for you to fight off common infection or bacterial infections, along with other viruses and diseases. If not treated, it can progress to stage 3 HIV, which is known as AIDS, acquired immunodeficiency syndrome. HIV and AIDS are not curable, but can be treatable with certain drugs and lifestyle changes to ensure a long-lived and better quality life. Common symptoms for HIV and AIDS include symptoms that are similar to the flu virus. These symptoms will not start until after 2 or 4 weeks of infection. These may last a few days or several weeks depending on the person and how their body reacts to the virus. Some of the symptoms will include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers, and they are also all similar to other diseases that are common, making this HIV and AIDS virus very difficult to identify without tests. Symptoms may not appear during acute HIV infection, or if the carrier does not produce symptoms, they will be able to pass it to other people, but will remain a carrier and unaware of their infection. 1 in 7 people living with HIV are unaware of their infection and continue to spread the virus without any knowledge of doing so. Transmission. There are 4 major aspects of transmission. The first one is through bodily fluids such as semen, blood, rectal and vaginal fluids, and breast milk. Another one is through vaginal or anal sex with someone who has HIV. The third one would be through sharing needles or syringes that may come in contact with infected blood. Also, from mother to child during pregnancy, birth, or breastfeeding. Testing. There are 2 main ways to test for HIV and AIDS. The first is a blood or saliva test that can detect antibodies within the blood to determine if the virus is present within your body. This can take several weeks after transmission, and the HIV antibody test will eventually come back positive after you have lived with HIV for multiple weeks. A more accurate test for sooner diagnosis would be the test for antigens, which are proteins produced by the virus. This test will detect HIV just a few days after infection rather than a few weeks. Both tests are accurate and easy to administer. $1.2 million people are living with HIV in the US in 2019. And while that has continuously gone down from the beginning of the epidemic, it still remains in mostly concentrated populations throughout the US. Approximately 40% of individuals have been tested in the US. This is less than half. Women are more likely to be tested than men are. Ages 35 through 44 are tested the most, while ages 18 through 24 and 65 or older are tested the least. Regarding education, post-high school education resulted in about 48% of people being tested, and college graduates about 46%, meaning that those with higher education are more likely to be tested. Regarding household income, those who made $35,000 to $49,000 and less than $15,000 had the highest brackets for testing, meaning those who bring home less than $50,000 a year are more likely to be tested than those who bring home a higher income. When regarding mortality, about 690,000 people have died from AIDS or AIDS-related illnesses since 2019. Since the beginning of the epidemic, 32.7 million people died from AIDS-related illnesses. While the mortality rates continue to decline, there are still many people who die yearly from HIV and AIDS, and most without knowing they were even infected in the first place. New transmissions. Approximately 1.7 million newly infected people were walking around in 2019. Progressively, there has been a decrease in transmissions in the US, but there are continuous transmissions in some areas that have particularly high transmission rates. In 2018, gay, bisexual, and other men who have sexual intercourse made up the largest group of new transmissions at about 66% of new cases in 2018. When you look at the chart, you can see that from 2010 to 2016, there has been a progressive decrease in the amount of cases. However, in certain groups such as Latino, gay, and bisexual men, there was an increase, making them the biggest group for transmission. Regarding treatments, there is currently no cure, but there is a type of medication that makes HIV and AIDS easier to live with. This is known as antiretroviral therapy, or ART. This reduces the amount of HIV in the bloodstream using a mix of different medications. Regarding prevention, and specifically primary prevention, individuals can be more mindful of who they come in contact with, and if they come in contact with any bodily fluids, blood, semen, rectal and vaginal fluids, and breast milk without knowing the HIV status of the individual carrying the fluids. Secondary prevention can be altered by getting tested early if you start to show symptoms, being mindful of who you have sexual encounters with and their HIV status, and if you are to get HIV or you think you may have HIV, to get tested and to confirm that you have it, and then begin medication as quickly as possible. Tertiary prevention, regarding making life a little bit easier while carrying this virus. A good way to lead in that prevention is to continue to use the medication, start the medication if you haven't, and follow a lifestyle suggested by your doctor to maintain healthy living. Another prevention level that we can influence is support. There are support groups that can help in managing your life while living with HIV and AIDS through the support of other people going through these same things. Also, making it a social norm to be tested and to spread your HIV status without stigma or shame, allowing people to know what they are coming in contact with, who they're coming in contact with, and if they have a chance of getting HIV or might already have it. These are my references. Thank you.